Hi, Dr. Milan. Welcome to today's session of Expert Talks. My name is Nugua, and as usual, we have an expert here who will be talking about all things women's health and fertility, cycle tracking, and Fibra. So, welcome, Milan and Dr. Milan, and thank you for making it to this session. Could you tell us about yourself and your journey to how you started Lotus Integrative?
I have been a nurse practitioner and midwife for over 25 years and have been working with um, families and women for all of that time and decided to focus on natural health and looking at the root cause. And so I started Lotus Integrative Health and Nursing to do that and to help women understand, truly understand the root cause of their issues and then address those with lifestyle medicine, herbals, supplements, and prescriptions so that they can truly have a holistic approach to their health.
Amazing. And how long have you been in this practice?
I started this 5 years ago
Mm-hmm.
uh, and have seen some incredible outcomes with, folks healing, because they're understanding the root cause. And so they're reversing disease, improving their health conditions, and just feeling more vital.
Amazing. And
Yeah, feeling more vitality.
yeah. And you focusing on women's health, I'm guessing that's, I mean, apart from your journey of like venturing into healthcare, I'm wondering like women's health, was that something that you were like extremely passionate about that led you into the specialization, or like how did you find yourself just focusing on only women's health?
Well, I mean, I started my career as a midwife and
Hmm.
that, pregnancy care, deliveries, and, I decided to expand to family practice, but that's always been my passion to help women. And in family medicine, I helped women and their families, but I've
Hmm.
always focused on women's health, just because that's who I connect with and who I want to help.
Hmm.
Um,
Amazing. And what would you say has been the most rewarding part of your job?
I think helping people heal, really seeing people improve their lives and improve their families' lives. That's been the most rewarding thing for me to see women, feel that they're supported in their journey.
Amazing. So Lotus Health has offers functional medicine and coaching. Um, your expertise covers different angles as fertility care, weight loss, menopause. And based on your contribution or your expertise, what would you say is the most challenging thing or fertility challenge that you see as a recurring problem in your patients?
Yeah, for fertility, I mean, we're looking, what are the root causes for fertility issues? We see unexplained fertility as a common sort of diagnosis. I think that is not true. I think there's a root cause for why folks are having trouble getting pregnant. And I think you have to look at number one, both partners, male and female, if you're looking at a heterosexual couple, what's happening to egg quality, what's happening to sperm quality. And, why are, there's a lot of reasons people aren't having regular cycles, they're not ovulating, they don't have good egg and sperm quality. So we're looking at all of those factors as to what is the root cause of those issues. And in my head, there's a couple things that kind of speak out to me when I'm looking at those folks is, where's their lifestyle, where's their health, what are they eating, what are they doing, how are they moving, what kind of toxins are they exposed to, are there endocrine disruptors there, what kind of inflammation is happening, underlying inflammation that could be contributing to hormone imbalances, thyroid imbalances, and what nutrient status do they have, where are their nutrients coming from, do they have the nutrients to perform all those cellular reactions, and then I'm looking at the gut microbiome and the reproductive microbiome, where is that contributing to health as well. Is their digestive system working? Are they getting the nutrients? Are they getting inflammation because of the digestive system? And then for the reproductive microbiome, I'm looking at, is there an underlying cause for inflammation that's contributing to problems in, ovulation, fertilization, hormonal balance? So, I mean, there's a lot of myriad of issues that could be contributing to fertility, and you want to look at all of those pieces of the puzzle, and it's probably a little bit of everything, and that contributes to fertility issues.
Hmm. Very interesting. So, from what you've mentioned now, I feel like I see like a common theme. Many times, of course, you have to, no matter which of the sexes comes to you for, I mean, you specialize in women's health, so it will most likely be a woman coming to you. But if in the case of a heterosexual couple, you're also looking at the man as well. And diet seems to be a key thing, or nutrition rather, seems to be a key thing. Um, it's so interesting because, I mean, for the longest time, the phrase "you are what you eat" just seemed like every other phrase. But now, seeing that it plays such a major role in fertility is quite mind-blowing. Um, and in this situation, do you also help couples address probably in terms of their fertility, where they're lacking with their fertility or like where they're lacking with their nutrition? Do you help in terms of maybe curating a meal plan or helping them go on certain supplements? I'm just trying to understand the process flow.
Yeah, so typically what I'm doing is looking at all the labs, looking at all the diagnostics, understanding where people are coming from, and then addressing those issues. So certainly everybody who comes through my program is getting a visit with a dietitian to understand their diet, understand what nutrients may be lacking, what
Mm-hmm.
kind of changes they need to make in their day-to-day food intake.
Mm-hmm.
Also looking at, is that something that we can do through food? Is there nutrients missing that need to be supplemented?
Mm-hmm.
We need to, move more. Stress is a huge component of fertility, which, um, you know, we really need to look at. Is there a component of high cortisol that's inhibiting other hormones from acting normally and giving normal
Mm-hmm.
cycles, or helping with egg and sperm quality? Uh,
Mm-hmm.
they're all factors. The diet is really important. We also have a lot of toxins in our foods, so kind of lowering toxin load is a
Mm-hmm.
really important part of fertility. There's so many parts of that puzzle, and I think people are focusing on one aspect of it, and they're
Mm-hmm.
not getting the results they need because they're just doing supplements, or they're just doing diet and exercise. They're not
Mm-hmm.
doing uh, the whole puzzle.
Mm-hmm.
And get each of those little puzzle pieces in place, then I really start seeing some incredible outcomes in people's fertility. And I can see through their charts, their cycle charting, their temperature, their BBT charts.
Mm-hmm.
Those are the things that I know Fibra is tracking.
Amazing. Um, that's so interesting because I was about to ask a question about, so how can Fibra supplement natural fertility methods
So
or
I think
conception
what's
methods?
great about Fibra, it's another tool in our toolbox to understand what's happening with your fertility. So if we're tracking temperature, we're tracking heart rate variability, we can understand what's happening in the cycle. And, cycle, obviously, your cycle is the most important piece of information we have about what's happening with fertility. So I think this is where Fibra can help patients, especially those who are looking for a tool like Fibra, something easy to use. It's underwear. We all wear underwear every day. Well, most of us do, maybe not everybody. But it gives us another way, a wearable that we can use to get information.
Hmm, amazing. Okay, that brings me to my final question. What excites you the most about Fibra?
I think it just gives people more options. And not using some of the other tracking tools doesn't work for everybody. And I think Fibra, it's not a one size fits all. And
Hmm.
we need other options for women for fertility tracking and understanding their fertility. And what I like about Fibra, it's something easy to use, easy to, kind of get information from. And the more options, the better. We need, as women, we have never been the top of research or the top of product design. And I love that. Fibra is just paving a pathway for information, obtaining information in a different way. And, I think there's so much more scope that we will see from Fibra. There's so much more data that we'll be able to get. I think looking at vaginal discharge is something that isn't being done. And I'm excited to see what information are we going to get from, vaginal discharge data. So, yeah, I'm excited to see where this goes.
Amazing. Thank you so much, Milan. It's been very exciting having you here, a professional and a doctor in specializing in women's healthcare and fertility for women. Knowing that research has set us back, like because women weren't included in clinical trials up until 1993, and we have so much of a gap, and seeing women who are focusing on, like yourself, focusing on specializing in how we can move forward in healthcare for women is just amazing to see. So thank you so much for all the work you do, and thank you for your time on this session today.
Thank you. It's a
Thank you.
pleasure here, and I'm excited to support Fibra.
Thank you so much. All right. Have a good day.